Hi, my name is Amy Whitekill with Provider Magazine, and I'm here today with Wincell O'Leary, and she is Vice President of Outpatient Integrative and Housing Services with Touchstone Mental Health.
Hello.
Thank you for being with us today. We really appreciate it.
Sure. Thank you for having me.
So, Michelle, can you tell us about Touchstone's innovative model for assisted living residents living with mental illness?
Yes, I would be happy to. So Touchstone is a mental health agency, a nonprofit agency in the Twin Cities in Minnesota. We serve adults 18 and up who have a chronic, serious, and persistent mental illness. Our assisted living also serves folk with chronic medical conditions, chemical dependency or chemical use disorders, as well as folks that are in poverty, below the poverty line, or have been homeless, and have been institutionalized over many years. And so our model began with research actually into neuroscience and architecture so that we could build the healing environment from the ground up and consider all of those elements of a healing environment for the physical space. We then brought in staff, which includes people like myself who are licensed mental health professionals, as well as nursing staff with psychiatric experience, and a host of other staff, mental health counselors, housekeepers, food service, activities staff. And then as a group, we really focus on our team-based culture to provide resident-driven services for the folks who reside there. Some of the things that are innovative about it are we are situated next to an outpatient and integrative services facility. So we've got access to fitness, nutritionists, acupuncture. We will soon have access to on-site primary care, mental health outpatient therapy. We also partner with the University of Minnesota and other local schools to bring in interns from various professions that we don't normally work with, such as occupational therapy, nurse practitioners, and pharmacy. So what we do is we work on really getting to know the mental health needs of our population, but also considering all of the other dimensions of wellness for a person and coming up with an individualized plan of care to help them at whatever point they are at. And we roll in other integrative medical and outpatient services to round out our continuum. Sure. Some of the things that we have done, we have worked with the U and measured our staff satisfaction with regard to interprofessional collaboration. So in the last 3 years in that measurement, we have achieved 96% internal staff satisfaction with communication. We've measured our resident satisfaction with our staff and services. Those also come back in the 96% range. We have measured and reduced hospitalizations by 40% and ER visits by 30-some%. And we have measured the impact on total cost of care. So we've taken a look at the institutional costs for folks prior to living in our facility. A year later, we've saved the system in Minnesota $2.4 million in institutional costs. All the while, people's health is actually improving. People are maximizing their independence. They're integrated into the community in things such as going back to work, going back to school, managing their symptoms so that their daily lives can be less impacted by mental health concerns. So oftentimes, assisted living is thought of as long-term care. And for some it is, and they may live there as long as they qualify. For others, because we serve young adults, some of these folks have no intention of being in 24-hour care the remainder of their lives. They want to come in and learn as much as they can, gain as many skills as they can, and return back to living in their own home in the community. So at the same time as we've got the assisted living going, we developed a line also to help locate housing for people in the community and bring all the various services I mentioned to people in their own homes out in the community.